for attending today. We're really excited to have Orville Morales here with the Public Goods Project. And I did just want to say before we get started that NJ Sophie has recently signed on as a part of this campaign, and we hope that as one of the outcomes of this program that perhaps you or your organization will consider doing the same. So I also wanted to take a moment to thank the New Jersey Association of County and City Health Officials, also known as NJHO. You may notice that my name is the NJHO host, so they have offered very nicely to let us use this Zoom system, so thank you to them for doing that. I want to thank the program committee for their support on our webinar series, and thank most of you because I do see quite a few returning names and faces on our program today. Just a couple logistical pieces in case you have not used the Zoom platform before. If you scroll over the screen right now, you should be able to see some of the faces thumbnailed as well as the first slide in Orville's presentation. On the bottom bar, you'll be able to see that there's a couple prompts. One of which is the mute key. So I will ask if you have not muted your line, just to kind of avoid any disturbances or feedback, if you could go ahead and mute your line. There will be plenty of opportunities for questions throughout. The other piece I'd like to draw your attention to, there is a chat box here as well. So if you'd like to click on that, it will open kind of a ongoing scroll of any questions or comments that people have. I'm sure you'll hear Orville say this as well, but please feel free to use that throughout the presentation. He would like this to be interactive, and I think he'll be asking you a few questions to kind of engage you on that. And from there, at the end of the presentation, you'll hear me reminding you about our evaluation. If you are seeking CHES credits, those will be available for NJ Sophie members. So make sure that you fill out the evaluation because we'll be pulling your numbers from that piece. So without further ado, I'm going to introduce Orville Morales. He is a seasoned project manager, community advocate, and marketing professional based in Northern New Jersey. Above all, he is a decisive and outcome-oriented entrepreneur who is passionate about serving those who serve others. Orville holds a bachelor's degree in anthropology, a master's degree in business administration, and is presently pursuing his international project management professional certification. He has also cultivated extensive community outreach and public speaking experiences. His most recent project has been working with the New Jersey Sugar-Free campaign, which strives to decrease sales of sugar-sweetened beverages and increase awareness of the health effects of such beverages. He also volunteers his time for the civic engagement to college students. Orville has a passion for public health and affordable housing. He also enjoys photography and salsa dancing during his personal time. So without further ado, Orville, I'm going to pass it on to you.
Thank you so much, Linda. Hello, everyone. It's a pleasure to be here today with you online. Thank you for NJHO for making this happen and offering this this webinar for us so that way we could communicate clearly. It's a great program. As well as thank you to NJ Sophie for partnering with us. If anything, we've learned as much from you as hopefully you'll learn from us today on the work that we're doing with NJ Sugar-Free campaign. To give you a quick background, and really the overall goal of this webinar is to, one, give you some insight as to the strategies that we've developed in order to address this particular issue. But I also want you to put some thought into how you could use some of these strategies for your own campaigns as well, in particular as it relates to the issues that are important in your neighborhoods, in your communities. And I'll be more than happy to take questions. We have approximately 1 hour, correct, Linda? So in that hour, I will go through this presentation. My eyes are on the group chat, so you can feel free to ask questions, and I'll periodically stop to answer some of them for you as we go along. I don't want anybody to feel lost or behind because I am very passionate about this particular project, so I may go a little bit too fast, so feel free to ask me for any clarifications and whatnot. A special thank you to the Nicholson Foundation. They funded the Public Good Projects to do this campaign, and I will now go deeper into the details of this campaign. So a quick agenda, I'm gonna give you a quick introduction of the campaign, of the Public Good Projects, as well as a case study of the work that we did in rural Tennessee around this particular topic and some of the findings of that campaign. as well as how we are going to, or how we're doing the same thing here in New Jersey. Of course, we'll give you the campaign overview, our goals, the strategy, which includes the conversation analysis around how people are engaging this particular topic, especially online, the audiences that we're targeting, and the themes that we're using to inform us how to create the messaging that we've been putting out there. Then I'm going to show you some content samples, some of which we started off with in the beginning of the campaign, and as well as some of our best performing pieces of content. You'll be surprised. They aren't just all pretty kitty cats and dogs, but there's actually some really good content that people are engaging with online. And then a timeline of the campaign, because it is overall a 15-month campaign, but this campaign ends in September, so your help and participation in this campaign is extremely crucial. And then, of course, I'll open it up again for even more questions at the end. So with that said, this is our team. I'm the community campaign manager here in New Jersey for the Public Good Project. Erin Enright is our partner coordinator, so as we gain partners, she helps us ensure that they're getting the right content that they need for their network to spread the message around sugar sweetened beverages. And Mangi Silver is the director of programs. She manages other projects that we have around the country. And to give you some detail about the Public Good Projects, we're essentially a collection of subject matter experts. We're passionate about improving health in our communities. So what we do is that we use a health communication system that combines the traditional public health practices. Consider the health fairs and the posters and the standard way that we engage our communities around public health. But then now we're using the latest digital and marketing techniques in order to reach a mass amount of people around the health messages that are important for them to learn about. And it's through extensive research and strategy development that we define the priority population, so that way we can address health behavior change specifically. And we all know how difficult it is to change behavior. And in this day and age, especially of marketing technologies being as advanced as they are, it's even more important to ensure that we're engaging our communities with the information that's important to them. So to give you some insight about where we're coming from and the logic where we're coming from with this particular campaign is with our 2015 case study that appeared in the American Journal of Public Health, which Linda, I'll make available for you that you could send to everybody after the campaign. And the objective of that campaign is similar to this one: to evaluate mass media campaign to reduce consumption of sugar sweetened beverages. The time frame in that campaign was 15 weeks within the Tri-City region of Northern Tennessee, Southwest Virginia, and Southwest Kentucky. The methods were disseminating messaging, emphasizing the health risks of SSBs through a variety of channels. And we evaluated the result of these campaigns with pre and post telephone surveys. So we started in the beginning of the campaign period, and we got a baseline of the survey, and then we finished it specifically for adults between the ages of 18 and 45. And the focus was the intervention area, especially examining the sales of beverages in the intervention area, along with a comparison area of Western Virginia. We're doing a very similar process here in New Jersey. And the results you'll find was that 54% of the 54% of the population recalled seeing a campaign advertising, as well as after the campaign, we saw that there was an increase in awareness of the issues around sugar sweetened beverages, as well as we were able to observe a increase in sales of over 3.4% of sugar sweetened beverages, with 4.1% specifically of soda sales in the intervention area. So we were able to really see, and the Nicholson Foundation granted us to do this research here in New Jersey to see if it was a campaign that was feasible to engage in. And upon that first mini grant, we were able to obtain a grant for a 15-month campaign, with the first 6 months being the research that I'll talk a little bit about shortly. And then now a 9-month execution of the campaign, which is where I came in and I am really focused on right now. So the campaign overview here is similar to the last one. It's to reduce sugar sweetened beverage consumption among Medicaid eligible 18 to 65-year-olds. And the challenge here is to educate audiences on the negative health consequences associated with sugar sweetened beverages. So you can see that there is similarities to a lot of different topics that health educators are dealing with, where they have a very specific population that they want to encourage them to learn more about the health effects of their behavior, but also finding ways of healthier alternatives. So I want you to keep that in mind as you're hearing this approach, because it fits very similarly to a lot of the different topics that you may be dealing with. These are our overall goals. So we're increasing knowledge of which beverages are sugar sweetened beverages, increasing awareness, audiences' intent to consume fewer sugar sweetened beverages, even increasing support for policies around sugar sweetened beverages. And of course, the big one, the one that we're going to use to evaluate the success of this campaign, is to decrease sales of sugar sweetened beverages. That is the precise behavior change we're looking for. When someone walks into a corner store and that they're making a decision to drink more water, that is the key evaluation for us. We need to see the sales decrease. So to give you a sense of how we're approaching this particular campaign, especially with social, is a very two-way communication method. It's not just the old days where we would put a post on the wall and we hope folks see it, but we can't really measure whether folks are engaging with that topic, and it's almost a trial and error in order to find the best kind of message, the best kind of way to engage people. The online world gives us the opportunity to measure who's having the conversation around sugar sweetened beverages, where this conversation is happening, and what aspects is driving the most interest around it. So it's essentially all of our content and messaging is based on how people engage with the issue, as opposed to us trying to push them to understand the issue as professionals. Because the fact is, many of us have spent years to learn the very specifics of the issues that we're dealing with. But when we're talking to one individual, we're not speaking in the same language as they would understand it. So we always have to try to get to their level to ensure that they understand where we're coming from. So as you can see by the graph here, as long as we had the topic, in this case, sugar sweetened beverages, we were able to analyze the themes that came out of this particular conversation. And then we were able to also draw out the audiences. To give you, I'm going to type in case you're curious what tool we use to get this information. It's a tool called Signal Labs. I just posted it on the chat. Signal Labs allowed us to do to measure social trends around keywords. It was a good tool for us to give us an overall sense of how people are communicating around this issue, what becomes popular in the region around this topic. And of course, we overlay that with other pieces of information like data from the CDC, county health rankings, .com, and many other tools to get a general sense of what are the themes that people used to really engage with the topic. So Signal Labs is the different one that you might not have been aware of. Hopefully you're aware of the County Health Rankings, a project from the Robert Wood Johnson Foundation, which gives a lot of great information around different issues in our communities, as well as the CDC, you know, of course. Quick shout out to some of the leaders, just such as Maggie Silver, as well as Dr. Joseph Miser, our CEO, formerly worked from the CDC and worked a lot on the anti-tobacco campaigns over the last 10 years. So we really got some good leadership around this particular topic. So to give you some insight on what those themes look like. So many of us would know this by our education. We know that there's people don't know between diet soda and sugar-free conversations that there's a series of negative health effects with them. But it's good to know that there's real people out there that are having this communication online. So for example, you see on the top left, diet soda, Mr. Tristan Anderson actually asked Dr. Pepper, have you all tweaked the formula of Dr. Pepper? The ones we have taste funny. Saying these commercials I watched said less sugar is used now, you can tell. You know, it still gives us a little sense that how sugar is used in these drinks, especially with diet soda, gives us a little bit of information about how we can create our content. Similarly, and of course, the conversation between fruit juice and fruit drinks, we have those conversations all the time. I've been grateful to meet a lot of health educators, and they really bring this up big time. Children and teens, they also, that's a huge thing, sugar and children and what it does to them. And even the vernacular that's used to express it gives us a lot of good sense of how people are engaging the topic. I do see a question from Anisha. I will answer that question in a quick moment. Other themes are policy and soda tax. That is a thing that's happening nationwide right now. Between Philadelphia and Seattle have currently soda tax. New Mexico, there's a couple cities over there. Even the country of Mexico are debating a soda tax. And certainly everybody knows how in New York City they were pushing a lot of policies around sugar sweetened beverages. What we found interesting is that when you push these types of policies from the top down, you have a harder pushback than when it's coming from the community. And that's something that's different now. In a campaign like this one, although PGP does not endorse any particular policy, it is important to pay attention to people's general attitudes around it. So to answer the question from Anisha, I know that sugar is the primary ingredient that consumers need to be aware of in their diet. Some consumers are substituting with agave, honey, and stevia. Any word if the substitutes are better or worse? So since we're focusing on sugar sweetened beverages, things like agave, honey, and stevia are what you add yourself. So you have more control of the amount that you add. So we don't focus on other products that are sweeteners. We focus on specifically sugar sweetened beverages. So in this case, you cannot control how much sugar Gatorade has in it. Technically, you could add more of it if you want to put agave in it, for example. But those are drinks that people don't know that there's large amounts of sugar in them, and consuming those are adding to the coffee you have in the morning. So imagine you drink one today, and then in the afternoon, you're putting more sugar in your coffee. We won't talk about adding the sugar, but that isn't to say that you can't say that as our partner, or NJ Sophie can't say that as they're promoting online. For the content that we create, it's around sugar sweetened beverages. So it's important to know that even though you're sharing some post that says, hey, drink more water, that isn't to say that your next online post isn't about the substitutes. So I hope that answers your question in terms of how we address the different ingredients that you're referring to. And if not, feel free to respond. I'll come back to it momentarily. So now you see that there's 8 different themes that we thought about as we were creating our content. Now, a quick word about the audiences that we found that are at risk. So when it comes to creating an at-risk audience, you have to, especially around marketing, you have to create some personas, some individuals that are representative. They're not meant to be just a stereotypical, this is what all these individuals are like, but it just gives you a general sense of when you're thinking about an audience, there are personas that you can create that give you a general sense of who you're going to be creating content for. And in this case, in order for us to decrease sales of sugar sweetened beverages, we have to target an audience that's at risk within the certain time frame, especially in our case. So we looked at women generally between the ages of 18 and to 65, and in particular, Latina and African American women. These ladies make most of the health decisions in their homes. They likely have multiple generations in their families. They certainly work very hard, so therefore the pressures that they have to make health decisions is often a lot harder. So we found that if we create content that helps them make better decisions, educates them around making alternative choices, especially because of the purchasing power of the population, we can ensure that when they're making that healthier decisions, and especially when it comes to creating our content, we're thinking about these individuals. So you can see that the general personas would be a woman who takes care of their family and works hard to make them proud, 25 years old, she's a receptionist and lives with her child, husband, and a mother. Or someone else who lives with their baby as a single mother, also a hard worker, maybe even a student at the same time. So we create content based on those various populations in the hopes that we can encourage them to change their behavior when it comes to purchasing sugar-sweetened beverages. So to give you some ideas of the content that we have right now, of course, we still believe that traditional posters always work. When you can see something that's eye-popping out in the community, when you walk into the local health center, maybe in some cases there's a Healthy Corner store. A quick shout out to the Food Trust that works on the Healthy Corner store initiative. They have some of our posters so that when folks walk in there, they can get a quick reminder not to purchase some of these drinks because they're loaded with sugar. And even from a messaging standpoint, one of the things that I want to encourage, especially as partners, and I want to bring this particular example out there, is with NJ Sophie. As health educators, I was definitely called out not too long ago about the fact, you look at the one on the right that says just one sugary drink a day increases your chances of diabetes. Of course, health educators understand that that is not particularly untrue. However, only type 2 diabetes is preventable. So with that feedback, we went back to our creative team, and now we're going to redo this poster, and it's going to have on the bottom saying that only type 2 diabetes is preventable. To learn more, visit NJ Sugar Free. So you helped us also adjust the conversation, because just because we see what's happening online, and even something like diabetes, folks understand diabetes, at least based on our research, that diabetes, they're kind of referring to type 2. But it's important to, when it comes to the population that you're dealing with, you know the community you're dealing with. So being partners with us and giving that feedback is extremely important. So that's a perfect example that happened recently, and there has been other examples. And that's why the part of the strategy, which I'll get into a little bit more later, has to do with our partners. So other kinds of posters and flyers are like for vending machines. That's particularly a key one. We often ask our partners to take the organizational pledge to actually either remove or increase healthier alternatives in vending machines, or altogether remove the sodas from the machines, or even just add these posters to remind people that the drink that they're about to buy has more sugar than anyone should have in a given day. Now, when it comes to online content, we actually are finding that informational content is really helpful. This has been a very popular poster that we have, that Red Bull has more sugar than a scoop of ice cream. And the crazy part is Red Bull tells us on their website. This isn't something that we're just coming up because, we're adding different, we're looking at all of the different types of Haagen-Dazs and Turkey Hill and doing the math. They're telling us. So it's important to tell the people that, guess what? Red Bull gives you wings for a reason, because you have a lot of sugar in your system. So other informational content that we have is the conversation around vitamin water. Is it actually better for your health? And even giving just stats around how 1/4 of New Jersey residents are obese and an additional 36% are overweight. A lot of it has to do with the consumption of sugar, with sugar-sweetened beverages. We have video, of course, and one of the things, these videos, are on YouTube. You can visit, let me give you the link now, because the content that you just saw now, plus the ones I'm going to talk about, you can visit NewJerseySugarFree.org, the download center, where you can access a lot of this content. One of the pieces of content that I recently worked on was gathering testimonials from ladies that are actually going through the difficulties of trying to make healthier decisions for their children. It's not always all positive. We don't always try to capture stories that fit our narrative. In some cases, one particular mother was expressing that she has to work so much that she only has time to buy fast food, and she gives her kids soda, and she would express that. And there's just some really powerful stories that you might want to check out, and those testimonials are on there right now. Oh, sorry. So, of course, in order to engage people online, memes are powerful. We know that. Simple messages, not everything has to be a high-produced pieces of content. which is what you just saw. Some of it can be extremely simple ideas and concepts. And when it comes to celebrities, people pay attention. And you can see these two. My favorite one is the one on the right with Michelle Obama, because whenever someone brings Coke to my parties, I give them the same look. You can see what we did in this particular image for those who are generally more politically engaged. But at the end of the day, we know that sometimes we just have to put together a couple pieces just to get people to engage with us, to like our page, to comment on it, and more importantly, to share. That's a huge one as well that encourages engagement on our sites. All of our content is in Spanish as well. So that's extremely important. And if anybody knows, this may fall into a little bit on the stereotypical side about Latinos being afraid of the chancleta and their grandmothers. It's very applicable to me. And every time I do this particular presentation and there's a Latino population there, they always react the same way. We all know that grandma, if in what the translation here says, is when grandma sees you drinking a soda while you're having soup at dinner. She would not have that. It's important. Even grandma knows we shouldn't drink soda. So that certainly has been a very popular theme. And the one on the right is the Latina's Just Judy. Essentially, when she found out how much sugar is in a soda. Another tool that we use that you can use as well that allows for, it's hard, I don't want to say lower quality content, but it's really easy to create, is canva.com. They have a boatload of templates around a lot of different topics that you could put together a nice Facebook post, Instagram post, social post, brochure, logo, and it's extremely affordable that could just help you make some good engaging content that you can share. Because what's important is not waiting for 6 months until a good piece of content comes up that you can share, but being frequent and active online. And we hope that you can use a lot of this content for you as you move forward. So some of our best performing content over the last month or two, these posts, in particular, any kind of quote that just states a piece of information. And in this case, we just attach our website, which already has a very good image embedded in the website. So it pops up very cleanly on our Facebook page or our Twitter page. So the one on the right is just the image that you saw earlier that we posted. Again, it was a higher quality, but it was a very effective tool to share. So you have access to all of that. Blogs, coincidentally, have been very popular. And we're seeing a lot in the Latino community are really accessing a lot of our content online, which makes a lot of sense. There's so much information out there. There's so much information out there that sometimes you don't know who to trust. So it's important that they're getting this information, not only from us, but all of you as well. You are the professionals. So making sure that people could have access to content that informs them really increases the trust level and encouraging their engagement. And yes, we do have one of the questions is about njsugarfree.com and .org. We own both, so it doesn't matter. You could access both particular topic. There is no difference between the sites. Interestingly, we are seeing a lot of traction around the soda tax. The conversation does vary between individual support for the tax and them being against the tax. In our evaluations, we do I'll talk about the timeline of our evaluation shortly, but this is an interesting one that we're seeing some interesting information pop up about. I'll talk about it shortly. So the campaign timeline. So right now we're in June, the campaign ends in September. You'll see the outcomes on the left. When it comes to partner signups, we are signing up partners all the time. Every time you sign up, which really includes just being willing to share the content for us. And I'll talk about what it means to be a partner shortly before I take some questions. But essentially, the partner signups will be ongoing until September. Now, when it comes to the evaluation, the campaign started in December. And in December, we did our pre-baseline telephone surveys throughout the state, asking them a variety of individuals a variety of questions of whether you believe what's the appropriate age you think a child should be introduced to soda, what do you consider sugar sweetened beverages, how many drinks do you have, and about 25 other questions, including like what I alluded to before, your position on the soda tax. Would you be supportive of it? Would you be supportive of a soda tax if it had if the money goes to a specific program, say decreasing childhood obesity? And we did again, so we did it. I see another question I will address in a moment. Then in April and May, we did our other evaluation just recently, where right now it's not statistically significant to announce the data because we're still midway through the campaign, but it offers us an insight on what are the issues that we should continue promoting. And what we're finding is that folks are really surprised about the different drinks that are sugar sweetened beverages, like the Gatorades, like the Goya drinks, certain fruit drinks that folks just didn't realize were in the same category of sodas and diet sodas. We also found something very interesting around people's attitudes of a soda tax. 40% of individuals found that the soda tax is not they would support a soda tax, but if you add that soda tax to childhood to prevent childhood obesity, the support went up to 54%. So we're curious to see what's going to happen in September when we ask that question again as we continue, as we ramp up producing these questions. So you can see the value of seeing a campaign like this and evaluating it the way we are. I have about 10 more testimonials that I'll be collecting over the next couple of months. Similarly with artists, we are recruiting local artists that are supportive of the campaign, and they're creating art pieces just so we can have some more creative content. You can see it at the NJ Sugar Freed website. You can definitely see some of the art pieces that we have available for you. I'll be collecting a couple more over the next 2 months. We do take feedback from our partners about our content. So if you feel that the content we have, that there's something else that would be more engaging for the audiences that you're speaking to, you can give us that feedback and we can redesign some of the content for you. In some cases, we could even offer to put your logo on it to really make it more authentic for your target group. Around September, October, we will finish, especially October, November, excuse me. We will have a formal toolkit for you. So this way you could get all of the content all at once, as well as the research. We don't want to keep the research to ourselves. This is very important for us to share with all of you the content around the findings that we've had. And of course, we're going to be doing a variety of speaking engagements at the end to talk about the findings. Because we feel that it could really be informative from a communication standpoint, giving feedback about the different types of how social media, what's the social media environment like in New Jersey, how folks engaging with an issue like this one, and hopefully engage a conversation. How can we do this with other different types of topics out there? And of course, we're always posting online. So anything you can do to share, to like, comment the posts we have, or even, and especially post yourselves, is extremely powerful. It's an ongoing process at this point. And one of the questions in terms of where you're measuring consumption levels right now, certain locations. So Paterson, New Jersey is a major location that we put extra weight on because the testimonials are coming out from the population there, as well as many of the artists. So we do pull a little bit, that's our control area. And then we're comparing it with similar areas such as Jersey City, Newark, Trenton, and a variety of other communities. And that's how we're comparing, that's how we're measuring consumption levels. So with that said, this is how you can support. Of course, if you are working for a particular organization and you want to take the organizational pledge, which would be one of 3 different levels, either just encouraging your employees to drink more water by encouraging conferences to have more water, or your meetings, as well as your just promoting more water or encouraging folks to have healthier alternatives to sugary drinks, or just not selling or providing or promoting. Most organizations, especially in the health field, are already fall into these categories. So it's really a simple of just signing up, letting us know, and you can become a partner. Of course, promote our content through your network. That's extremely important for us. We won't be able to really get the word out if it's not for the help for our community partners. And of course, just encourage either your social media coordinator to join our distribution network. And every week we'll send you a piece of content that you can share that week, just to make it easier for all of you. I know NJ Sophie is definitely on board, and they have a couple folks that are getting our emails, and the more people that we can get on the distribution system, the better. So with that said, I will open it up to any questions you may have while I take a sip of my coffee. I must have done a great job to explain the campaign.
I will also say to the group, if you prefer to ask a question versus typing it, just feel free to unmute your line. You're welcome to do that as well.
So I'm actually going to ask a question of everyone here. Have you ever approached communication or marketing in this way around the topics that are important for you? So while you think about that question, I'm going to answer Julia's question about highlighting some of the biggest challenges you face in deploying the campaign. The biggest challenge, I would say, is threefold, really. One is with our partners. Our partners sometimes, when we need to get content out, sometimes they want, oh, that was just a statement from Linda right now, that organizations don't have enough resources to generate content. You just took my answer. I love it. Sometimes they only could recruit an intern, and an intern with all of the things that an organization has to work on. When you give an intern the job of marketing in general online, they sometimes second guess a lot. So I do find myself spending a little bit of time with our partners, just helping them through, where I become a mini social media consultant for an organization. Fortunately for me, I really like to do that. So I do spend some extra time with some partners and giving them, case in point, Lincoln Park Health Department. They have an intern, master's in public health intern. And every week I check in with her to make sure that she's posting the content correctly, that they know the difference between a piece of content that goes on Facebook versus Twitter, because sometimes the images are a little bit different between the two. So I just have to kind of work through them. So that's certainly one of my issues. Number two, I'd say it is a very big state. So to try to get down to Burlington County to make sure that they're represented in the campaign, this is where having partnerships like with NJ Sophie, I'm excited about, because they have so many representatives throughout. And that's how I'm addressing that particular challenge. And thirdly, this is different. Even though we have the American Journal of Public Health having written one of our studies, sometimes health communication on this level is new. And when it comes to health communications, it is still about the same strategies that was used 30 years ago. But so much has changed in the way we communicate that it's been difficult converting some individuals. That has certainly been some of the challenges. But fortunately, the more folks I talk to, it really helps me address that. I just don't stick with one organization and, try to change their whole philosophy. I just go to, sometimes we reach out to some non-traditional partners. We've found that a lot of hair salons, I don't go to them, but they support us. And they certainly share our content with their populations, and even sometimes put our posters in some of the cities. Sometimes we had to be creative with who we connected with to do this work. Another question is, do we see opportunities to measure success? I'm glad that helped, Julia. Thank you. to measure success of the decrease in the consumption in other areas of the state in the future. Yes, we are in constant communication with a couple foundations, as well with the New Jersey Department of Health. The commissioner is fully aware of our campaign and are paying very close attention to the research in the hopes that we might be able to extend this particular campaign beyond September. So that is a work in process. That's the advocacy component of my work in ensuring that they're fully aware. I even get them to post content for us from time to time. So yes, we do hope to expand it around this particular topic, but we also are applying for funds to do other topics, such as opioids, mental health, and a variety of other issues, because, you know, our communities really need to learn a lot more about a variety of things when it comes to health. So hopefully we can get more projects.
Hi,
So
this is Lori. I'm an on-site health coach in Morris County, and my resources are CDC and American Heart Association and American Diabetes Association. I apologize if I missed this, but what are your sources?
The same ones. So we do the CDC, we get a lot of information from the CDC. Robert Wood Johnson and the County Health Rankings has been very informative for us. Of course, the American Heart Association, they're actually one of our partners as well. And what we do with them is that we white label with them. So in other words, they take our content and put their label on it, because we are not looking to promote the public good projects as much as we're promoting the health message. And an organization like the American Heart Association has a dedicated communication team that shares the content. So yes, it's a very similar sources that you just mentioned.
So I guess just another question, then a follow-up question, is that I can't really take your posters and email them to people, let me say, because it doesn't say National Institute of Health or American Heart Association on it. So what would you suggest for me?
So all of our content, at least the one that are labeled from the American Heart, of course, you won't be able to take, but all of our content that you'll find online, and we can even have a follow-up conversation to make sure that you can get some tailored content for you, whether it's just sharing a blog that we have, or even creating some content that is in a newsletter format, since you want to send things in email that might be able to be helpful for you to share. But if you check out our website, you should be able to find some content that you could just embed into an email that you can share. But if you'd like, just give me your email and I can follow up with you. Or even when Linda sends the follow-up email with some of these links, you can make sure you can just email me, and we can work together to make sure you get some content for you for emails. Because that's a very good question about, you know, sometimes not everybody's on social media, but they still have a big network that pays attention, and it's on email. So I'm really glad you brought that up. Thank you.
So yeah, so my question wasn't so much about the vehicle or the media, but I did get approval to distribute an article, let's say, about skin cancer from St. Barnabas. So that was very local, but it got approval because it was meaningful to the people here in Morris County. Yeah, thank you.
So it sounds like you'll get approval for content if the source is reputable enough, is what it sounds like.
Well, and then there are some things that, you know, we're a national organization that just wouldn't hit their radar. But let's say information on local hikes, you know, I'm allowed to share. So that kind of thing. Got it.
I mean, maybe if you bring up the Nicholson Foundation, because they're ultimately the funder of this particular campaign, and that should likely be on their radar, especially for Barnabas.
Thank you.
Okay, thank you. So I have two questions. How will the social media coordinator join to receive the content suitable for posting? So again, Linda's going to send out a follow-up email. Just have them email me, and I'll get them on the list. And where do you get or purchase photos for social media posts? So now when you're talking about, there's two things. You have some public domain photos. If you just go to your regular old Google, you could actually go to the advanced options and look for photos around the topic you're interested in that's in the public domain. That's one way. And another tool, Canva, actually allows you to license some photos for your online use that you can go and check out, read through the terms and conditions, but you'll be able to, and they're pretty affordable for those. And then you have sites like Adobe Stock, Adobe being the PDF provider. They also have a stock images that you can use for to purchase and create some of your content that you may be interested in. But when it comes to our content, all of the content we provide is free, so you could grab it and share it as you like. Any other questions? As I see, we have a couple other minutes.
Well, maybe we'll keep the line open just for a couple more minutes if anybody has any additional questions. But thank you, Orville, so much for your overview of the program as a whole, and I really appreciate the kind of the openness to the questions at the end. So as Orville kind of mentioned already, I will make sure that anything that was included in the chat as far as the resources gets out to you along with the evaluation. I will be sending that out this afternoon. I'll include Orville's contact information there as well, just in case you have any additional follow-up questions at that point. And I really hope that you will consider, joining in some capacity, whether it's formally signing on or learning a little bit more about how you can share the content, because I think, kind of as all of us know, in public health and health education, this is really right up our alley. So I am going to leave the line open until 11:30 if anybody wants to stick around and ask any other questions. But again, thank you so much for joining us. And consider.
I have a quick question.
Oh, go ahead.
Hi. So how do you account for in your social media analysis containing it to just New Jersey? I mean, we all have, social networks that spread across the country and across the globe. So how do you know that just people in New Jersey are talking about specific issues?
So there's a couple ways. Number one, Hootsuite. Sorry. That particularly is a social media dashboard where we pull all of our social media profiles and where we track certain questions. And especially with Twitter, Twitter allows you, especially on Hootsuite, allows you to do your searches based on your neighborhood, or rather based on your zip code and the certain radius around it. So we do that with New Jersey. So anything that is in New Jersey and we put, say, sugar-free or sugar-free, we can see what people are talking about from New Jersey in that. So Hootsuite has that functionality. Signal Labs, which I mentioned earlier, is our social media that allows us to watch these social media trends, allows you to do it also by local. The key thing here is that a lot of the computers use a particular IP address, and as we are analyzing information and we see where folks are from, we make sure that we keep it as close to New Jersey as possible. So it does allow us to see the activity in New Jersey, and in some cases in general regions like North Jersey, although we can't put zip code 07513, which is in Patterson, for the Facebook post. We can't be that granular, but we certainly could have a general sense, at least with Facebook. Facebook is a little bit trickier, don't we know it? Facebook is a little trickier with the way it offers that kind of data, but Twitter is definitely a lot more open about it.
Great, thank you.
Thank you for the question.
Great. Any other questions out there, either typing in or you want to chime in real time?
I would certainly like to hear what some of you folks would feel are the challenges for you individually in engaging with this kind of campaign based on your personal experiences. If anybody wants to admit to some of them.
I'll just say my own personal challenge is just not enough time and really a working understanding of a lot of the things that you just talked about with resources and where you can get images, and sometimes it just feels so overwhelming and there's so many other things that take paramount in kind of the day that it becomes a challenge. So just me on a personal level, I feel like, again, this campaign it speaks to me because there's good images and there's good messaging, but it's done for me. So I don't have to work quite so hard to actually create the content. So for me, both the organizations I work for and personally, I just feel that it really has a great appeal. And the message is what we sort of live for and what we live by kind of professionally. So I appreciate what it has to offer in an easy to use format.
Yeah, I definitely appreciate that. And I think one of the things that I find as I've been working with a lot of partners, when you mentioned the statement that it's been done for you, one of the things that helps us is that we know the audience that we're targeting, and we have a general sense of the themes, and we have the data. In the case of a lot of individuals, they have the messaging, they know what they want to share, but they don't have a clear idea of who the audience is, because most social media posts are one size fits all. So we need to create content where everybody connects with it. And sometimes you don't connect with everybody. You connect with the same 10, 15 people that you provide education for, then they are your audience. So for example, and I really thought about this in one of the conferences that Sophie had, that, sometimes the conversation around health behavior is a one-to-one basis. It is you and the client, and that individual is your audience. So when you're creating content, think about what's helpful to that person, or that group of people, the group of people that you've met over the last month, 3 months, and just tell them that, hey, why don't you just check out our social media page? I post tips on, how to quit smoking, tips on how to, drink more water, tips on this. And that's where you use the CDC to help you with extra content and American Heart, or create some things yourself here and there as you can. You can't write weekly blogs. That's not your job. Your job is to help people. And that's why I'm passionate about this work. I'm trying to help all of you to do better in helping people on an individual basis, which is why I appreciate what we're doing with PGP, is that we create the content for that mass distribution, but all of you are the ones that can tailor it to the people that are important to you. In this case, it's the people that you serve. So it's important that you focus on your audience and don't put that pressure on yourself on creating these, award-winning posts that equals what the American Heart Association does. The budget isn't there. And quick shout out, Linda, you're drinking seltzer water. That's my favorite. There you go. How funny would it have been if it was a Coke? It happened to me at an event. Someone walked in with a Coke while I'm doing this conversation.
We were slightly embarrassed with the amount of regular soda that was available at the NJ Sophie mid-year meeting. It was not supposed to be there.
but guess what? No one barely drank it.
Mm-hmm.
I actually took a picture of it that I was meant to send you. There was only one bottle of water left. So if anything, it was a very educated group. They passed the test. So good job.
We were happy to see that.
But with that said, focus on your audience and don't put all the pressure on trying to create these super duper pieces of content. Just try to educate the people that you serve. It'll grow from there. Your following will grow from there. Even this campaign, when it started, we definitely saw a relatively low outcomes. But as we adjust each month, as we see what our people are saying, not saying, we adjust the campaign, and now we're beginning to see a growth in our social media, where we do expect to see the bulk of our success is going to be in August and September. We know that to be true because we've done this before. So we know that towards the later end, when people are more aware of this campaign, as they're getting comfortable with it, as I'm engaging with different organizations, we're able to see that growth. It's similar for all of you. So you may not have all the budget, but certainly having just being willing to prepare a little small image, even if it's just, here are 5 steps in the message section with no image. Just keep pushing information, because when people do find your page, they'll see that you have some information, and then as opportunities like these pop up, your network is already connected with your group. So don't put so much pressure on you. What kind of pushback do you get from folks selling soda? So coincidentally, I'm going to start doing some interviews with corner stores to ask them about this particular campaign, and hopefully take some video and post them out. So I'll get you some actual anecdotal information over the next month or so. because that's one of the things I'll be working on. But in general, the pushback usually is either, well, people just don't like water. It's a taste thing. Or there's a misconception that water is more expensive than soda in some cases. So I'm actually going to be focused on proving that wrong. Case in point, just recently at a Walgreens, I saw that a 3-liter bottle of water was sold for $179 and a 2-liter Coke was at $289. Water was a better value. So that conception is just not true. And it really stems from the issue of food access in neighborhoods like Patterson and other urban cities. People, it's harder to get healthier foods, and when they do, it tends to be a little more expensive. And when you compare local stores or even local supermarkets to a Whole Foods and a Trader Joe's, the misconception that healthy foods is just more expensive is really pushed out there. So the pushback is that perception that water is more expensive because it's related to healthier living. So that's the kind of pushback I'm getting, that perception. But the soda companies haven't started yet to push. Once we finish this campaign and we prove a decrease and then we start promoting that, yeah, we're going to get some pushback. And that's where organizations like NJ Sophie are really important, because you're the grassroots organization that can make sure you're educating the population. The soda companies are just trying to keep their margins. Don't be fooled. This is the truth. And that's why this campaign is so grassroots in nature, because we know we'll get pushback and we can't depend on governments to communicate, the right message. Yes, sellers could lose sales if they go to the water fountain, but like in the city in Patterson, tap water is not much of an option. So in that case, it's not as applicable. But yes, they do lose sales unless the volume of water increases. They actually would break even. So there won't be much of a difference. So case in point, if someone drinks 2 bottles of water versus 1 of soda, the water actually would still bring them either the same amount or maybe a little bit higher because they just sold on volume. But if you just look at that information, just the sales part, then yes, they'll lose sales, but the profit margin can still be evened out if they drink more water.
All right, great. Any other questions? We are actually right around 11:30 at this point, so I'm going to give maybe one more call for questions. And if we don't have any, I want to say once again, thank you, Orville, so much for your conversational, kind of very approachable presentation here so that we could ask our question. Once again, you can look for an email later today that will have the link to many of the resources that Orville both spoke about and put into the chat box, as well as the evaluation. So regardless if you are going to be claiming CHES or MCHES credits as a result of this, I really encourage you to take the time to fill out the evaluation. It shouldn't take you more than 5 minutes. It's really helpful for us as we continue to expand our webinar series. And please make sure you keep an eye for our future programming. Likely we will have another one in October around advocacy. So thank you again, Orville. Thank you all for attending, and I hope to see you soon.
Thank you, everyone. Have a great day.
Bye-bye.